record on the... Right, perfect. I will start letting people in.
Okay.
Hello everyone, morning. We're just letting everyone in now to make sure everyone's connected. You can keep your cameras off and on mute, and then at the end you'll have a little bit of time to ask Sophie some questions. If you want to unmute yourselves, that's fine, or you can just pop it in the chat box. But I hope everyone's having a nice morning, even though it is raining and not very nice weather. Today we also have Vanessa Brown. She is marketing and sales for the UK and UAE for Euconia Lasers, which is where Emerald Laser is under the umbrella. So Vanessa, I'll hand over to you, and then we can introduce you to our lovely Sophie.
Thanks, Amelia. Good morning, everyone. Thank you for joining us on this rainy July morning. My name's Vanessa, and I'm head of Europe, Middle East and Africa sales and marketing for Euconia. And this morning we are joined by the fabulous and award-winning Dr. Sophie Shotter, who is a big advocate of technology that can not only help you age well, but also improve your internal health. So Dr. Sophie will be going through how non-thermal laser can be used to really improve your health, not only as a patient, but also as a consumer. So I will pass you over to Dr. Sophie, and as Amelia said, any questions, we can ask them at the end.
Hi, everybody. Lovely to see you all, and thank you for joining us on this Tuesday morning. And so, yeah, it's going to be my pleasure today to talk about the Emerald Laser, which is a non-thermal laser, and why I've brought it into my practice. Because for me, this goes so far beyond aesthetics, and I think that's a reflection of where aesthetics is heading. Sorry, click on my screen here. So for any of you who don't know me, my name is Sophie Shotter. I'm an aesthetic doctor, and I have clinics in Kent and in London. My real passion is not just about helping people look their best, but about aging well 360. And I first qualified in aesthetics in 2012, I think. Set up my first clinic in Kent in 2014, and in 2017, I think it was 16 or 17, I flew to America to train up in bioidentical hormones, because for me, I was really noticing that the majority of patients were coming into my clinic, and many of them were perimenopausal. Many of them were really struggling with how they felt, and they were hoping that doing something about how they looked would make them feel better. And I felt like I was treating half a patient. And so from there, my practice really evolved to be far more holistic and well-being focused. So yeah, that's kind of where my journey's taken me, very much inside out. And we all know that compared with even 50 years ago, compared with 500 years ago, we are living longer. We are, there was a time when women didn't really live beyond the age of 45. We weren't designed to live far past perimenopause. And nowadays, the average life expectancy is, I think, 83 for a woman and 82 for a man. So we're living longer, but are we living healthier? Because who wants to live to a ripe old age if you're not also healthy and functional? And we are struggling with health on a global basis. We have a huge amount of cardiovascular disease, the world's leading cause of death. We are developed nations spending a huge amount on healthcare. And I don't know how many of you have had recent interactions with the NHS at all, but it's struggling, even though we're an example of a developed nation. Fair enough, our spend on health is a little bit less as a percentage of GDP than the average for other developed nations, but we have a health crisis. And these statistics are from 2016. I'll share some more recent ones in a moment, but as of 2016, 13% of the global population were living with obesity. And I think it's important. Oh, sorry, I think I just got muted. So obesity is an actual disease. It's not just someone struggling with diet and lifestyle. Obesity is a metabolic illness. And as we are aging faster, living longer, and our fertility rates are declining, is that really the future that we as a society want, where we have a population with a lot of older adults who aren't necessarily healthy? We all understand, and I mean, for me, when someone I know retires, I'm like, brilliant, well done, amazing, you know, they've given so much and contributed to society. But we can't sustain that if we also have this declining younger population with an older population who don't want to and aren't fit enough to continue to be productive. So since 1975, obesity has tripled. It's truly a disease of Western lifestyle. And in 2023, there's more than 1 billion people globally who are obese. And this isn't just adults, it's also adolescents and children. And we now have a situation where, I mean, I remember in the 80s when I was a child, seeing pictures of children ravaged by famine. Whereas now, globally, there are more people living in countries where being overweight and obesity contribute towards death than those being killed by being underweight. So I'm going to talk through a little bit about the emerald laser and why I brought it into my clinic. And when you look at the long list of potential benefits of non-thermal laser, you can see the ones highlighted in green that are particularly relevant with the emerald here. You can read it. It almost reads too good to be true. How can you get something that's non-invasive with no downtime and no pain, but is decreasing fat, reducing cellulite? And then for me, what gets really clever here is optimizing mitochondrial function. Because I don't know about you, but mitochondria are being talked a lot about at the moment. We have immune boosting properties, anti-inflammatory effects. We're showing downregulation of stress and accelerated wound healing. It really is this long list of enormous benefits that, for me, looking at the surface level, I'm thinking, this sounds really interesting and it sounds like it could be a great fit for my practice. But mitochondria are there as cellular powerhouse. These are, imagine them as the battery of the cell. They're what's responsible for producing energy. And mitochondrial health is a crucial pillar of healthy aging. And we know that dysfunction of the mitochondria has been identified as one of those key hallmarks of cellular aging, which if you haven't already heard about, you will hear so much more about, both across the well-aging and the skin and aesthetic space across the next few years, because these are the things that we're targeting when we're talking about how we can age healthily on a cellular level. And what we know is, for me, I guess the sticking point, when I first read about the laser, was like, I can't understand how this laser can penetrate through to the fat cell and create a pore in the fat cell. And the answer is it doesn't. It has a target within the cellular membrane called cytochrome C oxidase. And this is all about boosting ATP production within the cell. So that's how this is working. This is really helping. ATP is your cell's energy currency. And by targeting this chromophore within the cell membrane, the laser is able to boost ATP levels and improve mitochondrial function. And then when it comes to fat loss and body sculpting, how is it that we're working? So the market's huge, and when you look at the cost to the economy of obesity, it's comparable to cigarette smoking. So comparing it to another, although I would argue that, as I said, obesity isn't a lifestyle choice. Obesity is a disease, and so are many of the consequences of cigarette smoking. But we really do have a worldwide epidemic of obesity. And when we have a solution that is suitable for the very vast majority of people, that's been given FDA clearance in the US for patients with a BMI of up to 40, with no pain, downtime, or side effects, and providing a large circumferential reduction in fat in a body, that's pretty impressive. That has a place within the aesthetic space. So we now have a device that's improving our mitochondrial health that also has this proven aesthetic benefit. And when we compare it to other technologies that are available on the market for fat reduction, we have cryolipolysis, and we have heat-based treatments. And this can be lasers, it can be things like HIFU, it can be things like RF. And these all work by killing a fat cell, a process called apoptosis. Whereas with the non-thermal laser, through this photobiomodulation, you're creating this temporary pore within the membrane of the fat cell. So it's a completely different process that is not involving death of the fat cell, and that's important to understand. Because what we know, fat cells, adipose tissue, it's an endocrine organ in its own right. And a normal adipose cell, a normal fat cell, behaves very differently than an enlarged fat cell. So what happens as someone gains weight is that generally their existing fat cells become fuller and fuller and fuller and fuller. You only grow a new fat cell at the point where, you know, you're significantly overweight / obese, and every fat cell in your body is full, and then you might start growing new fat cells. But we have to understand that these fat cells are, they have effects on our immune system, they have effects on our systemic inflammation. And when you have one that is enlarged, it's behaving very differently than one that's lean, And so what we can do with the laser is change the behavior of our fat cells by making them behave more like lean fat cells, so have more health benefits. And you can see in the picture on the left here that a lean fat cell can actually help to protect us against vascular dysfunction, against diabetes, against cardiovascular disease. So fat isn't the enemy. It's about making our fat tissue healthy. So I think for me that this really does explain, when you look at the difference between when we're talking about cryolipolysis versus non-thermal laser. And I've had cryolipolysis in my clinic since my clinic's earliest days, 2014. And we've had great results with it on stubborn pockets of fat. But you are prompting a process that's involving destruction of a fat cell. And with the non-thermal laser, we are preserving that fat cell, but working to change how it behaves so that the individual having the treatment can harness all the positive benefits that come from having smaller, healthier functioning fat cells. So anyone who knows me knows I love data. And for me, research and clinical evidence are just so important. Oh, sorry. And this treatment started out as an adjunct to post-op liposuction. And what was noted was that, so when you liposuction, slightly gory pictures, but that you can see on the left that it looks somewhat more, I guess, chunky. I remember, and I know I am aware that sometimes as a doctor, things that sound normal to me don't sound normal to other people. But someone once described liposuction after it's been liposuctioned out as looking a little bit like baked beans, because you can see that there are still cells. It's still sort of this chunky matter. And you can see on the right, this picture here is of someone who was given liposuction after having been pre-treated with non-thermal laser. And you can see how smooth that fat is. And that's because it's been emulsified. Emulsified just means broken down by the laser. So you can really see the difference that the laser has made visibly to these fat cells. And then some in vitro testing was done, and that showed actually visually the fat being emulsified, being broken down, and then leaving the fat cells through this transitory pore. And I think a picture tells 1,000 words, and you can see that in process here in the pictures on the left. And under scanning electron microscopy, you can see here that at 4 minutes after laser exposure, about 80% of the fat has been emulsified. And by 6 minutes, all of that fat is lying in the interstitial space, which is the space surrounding the cells. So it's left the fat cells and it's sitting in the area that's drained by our lymphatics. And this video, which I'm going to click, shows the formation of that pore happening in real time under the influence of the laser. So you can see that pore just opening up. And again, another great video. I love the fact that we can now actually show videos, and you can see, I'm going to play that one again, this fat being emulsified, being broken up, being liquefied so that it can then proceed to be drained. So when we have increased fat cell size, this creates this dysfunctional adipose tissue and increased levels of cellular stress and inflammation throughout the whole body. The non-thermal laser raises our ATP levels and gives this kind of small, sharp burst of reactive oxygen species. And this activates various genes that then stimulate the formation of this transitory pore that allow these fatty acids and triglycerides, the emulsified fat, to leave the cell itself. This pore then proceeds to remain open for 48 to 72 hours, which is kind of the critical time in which people need to be conscious of what they're doing after their laser treatment. So we now have the fat sitting in the extracellular space and we need to drain it. So these are absorbed by the body's lymphatic system and taken to our lymph nodes, where they're then hydrolyzed and free fatty acids are formed. And these free fatty acids are then removed in normal waste, or they're used as fuel for our body's function, whether it's muscle activity or how our organs work. And so a key part of this process also is having healthy lymphatic drainage. So making sure our patients are staying well hydrated and that they're mobile. They're not just sort of sitting around for 48 to 72 hours, because we want to help our body, our lymphatics, to drain away as much of that emulsified fat as we're possibly able to. So some of the studies, and this one shows, this is a double-blind, so placebo-controlled study that shows the effect of contouring on the waist, hips and thighs. And you can see here, if you look at the graph, and this is again, American Journal of Cosmetic Surgery, a great publication. The placebo group is the top group and the test group is the lower line. And you can see how much more dramatic that circumferential reduction is in the test group. It's significantly, they've lost significantly more inches. And when we talk about 4-inch fat loss, which is what we're seeing, 4 to 4.5 at 2 weeks post their laser course, this is what approximately a 4-inch fat loss equates to. It's about 5 pounds of fat. And I always find these images when we realise, that picture of 5 pounds of fat is always pretty shocking. And so, again, another thing that differentiates when we compare the emerald laser to other pain-free inch loss treatments that are around, like wraps or using sorts of saunas, a lot of that is water loss, whereas with this is really about fat loss. This is specifically targeting the fat cells. And the previous study was on BMIs of up to 30, whereas this one's on BMIs of 30 to 40. And you can see here, at 2 weeks post their treatment, a 6-inch, well, 5.99 inch loss. And this is again across the hips, waist and upper abdomen. So a significant amount of fat reduction. So how do we know that the fat isn't being directed to other parts of the body? Well, because we're preserving the fat cell rather than destroying it. So you're not creating this this effect whereby the fat has to go somewhere. Any fat that's still sitting in that interstitial tissue will be reabsorbed into the fat cell once in due course. So you need to take the opportunity for the lymphatics to process it, but you're not killing a fat cell and making the body go into a mode where, oh, I need to store more fat, because our bodies need fat to function healthily, and our bodies also get used to a particular amount of fat cells in our body. And we don't want to stimulate a response where our body goes into that preservation mode. And you can see on the left here the number of different roles that fat tissue plays as an endocrine organ. It has a role in insulin sensitivity and therefore glucose metabolism, helps how our blood clots, energy levels, obviously fat metabolism. I think immunity, where our immune, I think many of us now realise how much more complex immunity is than we ever imagined. And angiogenesis is the formation of new blood vessels, and blood pressure control. And again, high blood pressure is such a common problem in society today. So as we age, many of our body's functions slow down, and our ability to maintain these functions is not as good as it used to be. So we know that with non-thermal lasers, and this isn't just the emerald, there are also other non-thermal lasers within the family, red or violet lasers. You can speed up cellular reproduction. You can prompt quicker recovery if you've had an injury. You can raise the output of certain enzymes in the body so that you can get better oxygenation and better immune responses. You can reduce scar tissue formation, reduce inflammation in the body. You can stimulate lymphatic and blood circulation. The list goes on and on. You've got all of these different benefits. And I'll throw another one into the mix, because when I was in Monaco, I had a pounding migraine, and I went and had a session sitting under the laser, and lo and behold, headache free. And some images, some pictures that tell the patient stories. So this was 5 treatments of 30 minutes. So you can see that the significant reduction in the size of the abdomen, but also across the thighs, and you can see the improvement in the appearance of cellulite. And of course, some patients will have multiple body areas that are concerns for them. But what actually we tend to know is that if you have patients like that, treat the abdomen first, because when you treat that abdominal fat, that tends to be the most impactful on the whole body and can have impact beyond just that treated area. This is 6 sessions done on a weekly basis, and how frequently people have treatments, whether it's weekly or 2 a week. The advice varies a little bit between practitioners, but how we're doing it is when someone has a little bit more fat to lose, we're doing the sessions on a weekly basis, just to give the body's lymphatics time to process that fat load before we then go and add to it. And then once that fat loss process has started and things are in progress, then we might increase to doing 2 sessions a week. This is 6 sessions done 1 week apart, and these results are at 8 weeks. So 2 weeks after the final session. And you can see when you look at the picture on the left here, and obviously I haven't examined this patient, but it really looks to me like that's fat that's also visceral fat sitting around the organs. And you can often see that based on the shape of an abdomen. And you can see how significantly that's reduced. And I am sure that that will have massive health impacts for the patient. Men, and again, typical fat distribution associated with visceral fat deposition as well. And these sorts of results are life-changing. And you can also treat smaller areas like the chin, which is a really common area of concern for so many of our patients, both on an aesthetic level and and on a people want to look how they feel, and they might feel healthy, but this submental area can really make them look bigger than they are, older than they are, less healthy than they are. And again, completely safe on any different skin type. It's not like where with thermal lasers, we have to consider skin type in the settings we use. Arms very treatable arms are very treatable with the device. And I think this is a really nice little testimonial from a patient in Sweden. And this was an overall 8-inch loss on a patient. So what I can say about how we've introduced it is taking the fat loss, the aesthetic side of things, as a secondary benefit to the health side of things. For us, our patients are going through a screening process to make sure that things like their thyroid are working. Doesn't mean you can't have the treatment if you have, for example, an underactive thyroid, but it should have been diagnosed and it should be being managed, because we want our patients to have the health benefits of these results. So it's very much led also by our private GP, as well as our wider health team. If we're concerned that a patient may have an underlying condition that's contributing and could impact the results they have, then we might run some blood tests just so that we can make sure we have them optimized beforehand. And we also work synergistically with our nutritionist, because what's amazing about this treatment is, yes, patients can have their initial course, but for me, I don't understand why you wouldn't want to get under this on a regular basis long term to keep having those health benefits, and tying it in with a nutritionist to re-educate people on how to nourish their body, because we're all different, so that they can then help to enhance and preserve those results. For me, that goes hand in hand to helping our patients live a better life. And I'm very happy to take any questions.
I was going to say, you can either unmute yourself or pop them in the chat box, and I will be looking at, oh, you just see where our chat box is. Okay.
Yeah, they're amazing, aren't they, Suzanne? She said in the chat, stunned by the results. And, you know, for example, we have one patient who started out as a size 18 and is now buying a 14. So, you know, these are results that are amazing in terms of, you know, we're talking about something that can aid healthy fat loss, but also provide all of these other aging well benefits. And someone asking about whether or not the NHS would benefit from this to tackle obesity. I mean, absolutely, in principle, yes. But the tricky thing we have is of course resource, and the NHS is a vastly under-resourced system. So as much as I think it could be an amazing adjunct, I'm not sure we're going to see it in the NHS's treatment offering anytime soon, unfortunately. I think as a society, we all have to start. We've grown up in the UK in a very privileged position with healthcare being free at the point of delivery, but we have to realise that actually best healthcare, best health is something we're all going to have to start investing in. Do you think all of those going in for lipo should have this before and after? I absolutely think it would be an amazing addition for patients having liposuction, because again, you could see on that picture how much more broken up the fat was, and therefore how much easier it will be to extract, and also those anti-inflammatory benefits. I absolutely believe it would impact on outcomes and recovery from liposuction. Yeah, smoother results, exactly. Can anyone of any age use this? In principle, yes. My clinic, we're CQC registered and we only treat over 18s, but because this is a device where you're literally lying down for half an hour, you turn yourself around halfway through, or the device is repositioned halfway through. There's no pain involved. There's nothing that you'd have to navigate through with a child that might be tricky for them. So in principle, if you've got a child who could hold still, I think it could be a really useful adjunct. Do I think that this could improve the workings of female hormones, menopause, etc.? So I think, again, we're only at the tip of the iceberg at the moment with understanding everything that comes with perimenopause and menopause. But we do know that one of the big things that happens is that women start to distribute their weight differently, and they tend to gain weight and hold on to more central fat. So absolutely, it can be a great treatment for that. And again, I know many people now who've had great results in that difficult demographic where losing particularly stomach fat can be very, very hard for these women. But also, because we're impacting on things like mitochondrial function, absolutely, I think it can have wider impacts on our body and our endocrine system. So fat is also an estrogen producing tissue. Every system in our body talks to one another. It's all interconnected. So one thing starts to misbehave and it will have knock-on effects on something else, etc., etc. It's this continuous spiral. So absolutely, I do believe that by impacting on how our mitochondria behave and on how our fat cells behave, that we can have a bigger influence on menopause, full stop.
I was going to say, Sophie, when your clients come into your clinic, what kind of consultation do you give them before putting them on like an Emerald regimen?
So we obviously, for me, first and foremost, everything has to come down to listening to what someone wants to achieve. And probably the only reason I would likely say no to someone is if I thought they had completely unrealistic expectations of something. Of the device. So for me, if someone was wanting, some of the results I've shown you are incredible, but if someone's expecting that within a week, it's not going to happen. So we need to make sure our expectations are aligned. But we tend to consult them, yes, from an aesthetic standpoint. What is it they're wanting to address from a fat loss perspective? But also from a health perspective. So a very in-depth conversation about, as I said, thyroid, where their hormones are at, what's their lifestyle like? And then we'll make sure that they understand this isn't about you must change your lifestyle completely in order to get results from Emerald, but you do need to hydrate and you do need to move your body in order to help your body to drain those lymphatics so that you can then excrete the fat or process the fat properly rather than it be reabsorbed. So you do have a role to play in your results through your post-care. So we'll go through all of that. And then we make sure that if there's anything that we feel is necessary from a testing perspective, that we arrange that. We measure our patients, obviously, we take photographs beforehand. And I also think something like this can be an amazing prompt to help people take ownership of their lifestyle, whether that is in thinking differently about the stress levels in their life and what they can do to mitigate them, because we know cortisol plays a huge role in fat metabolism. Whether it's to do with the fact that they're not nourishing their bodies properly and depending far too much on a Western diet and lifestyle. So we take it as an opportunity to really look at all of that, so a patient can use it as an opportunity to give themselves a kickstart.
Amazing. And what is the price point in your clinic when someone comes in?
So we charge for a course to £2,500. So we include a lymphatic drainage with the body balancer, and we include all of those consultations I said, including a touch point with our nutritionist as well.
So that's interesting that obviously you include the body balancer. What kind of benefits would you say that you get from that?
So body balancer is a lymphatic drainage device. You could achieve the same with a manual lymphatic drainage massage, but the body balancer is really nice and relaxing. It's hands off. And, you know, for example, yesterday we had, I think we had 4 patients in a row staggered, so all having emeralds. So my therapist could manage both at the same time, because one would move on to the balancer as the other one was then moving on to the emerald. So it lets us treat more people. It's proving really popular.
And I was going to say, in theory, obviously, emerald is a great combination treatment. Do you think the wellness benefits and the boost in your health is going to help improve other treatments that you offer, so like polynucleotides or exosomes, etc.?
Absolutely. And this is why I started from the perspective of mitochondrial health, because, you know, for me, we are moving ever more into a space where aesthetics and longevity medicine overlap. And we now know also that how our skin ages has a direct impact on how the rest of our body ages, and vice versa. Our body can age our skin. And patients, my patients don't just want to look good and feel rubbish. They want both. They want to look good, they want to feel good. And so for me, absolutely, if we can enhance how we're working on a cellular level, then in principle people should be able to get better results from their treatments. And the other treatment combination we're using a lot is also in association with weight loss medications. So we're combining an awful lot with Wegovy or Manjaro, which are led by my private GP in the clinic, rather than by me. But we're doing a lot of combination treatment protocols.
So do you think they can counteract? I've heard from quite a few people that obviously Wegovy and Ozempic, etc. Some people, obviously, you build up the level of the doses, don't you, in order to help your body transition through it, but they feel not so well or a little bit sick. Can emerald in combination help that sickness, do you think?
I think I haven't in principle, it can certainly, I think, improve any discomfort that people experience.
Yeah.
I haven't got any specific patient examples where I can say actually it reduced their nausea. But for most people, the side effects tend to be quite mild and short-lived. And for me, it's synergistic to help give them an extra kickstart.
Amazing. So does anyone else have any questions for Sophie? That might be it. I'll say, Sophie, you've jumped on the emerald yourself. What benefits have you seen?
So for me, I'm still very early days.
Yeah.
I think I've had 3 sessions. So so far, just watch this space with me. But my team have been, it's always typical for me. I didn't want to start having a course of treatment until I knew I was going to be in the country to have a complete course of treatment with the right interval, which is why I waited. But my team were straight on there, and actually many of my team have had some really incredible results.
Amazing. Any more questions? I'll say, if anyone has any more questions that they can think of after, just let me know and I'll pop them over to Sophie. We've also recorded this, so I can send this over to you if you want to watch back in your own leisure and just go over the points Sophie's mentioned or the presentation. But no, thank you everyone so much for joining. Sophie, it's been really, really interesting and hopefully a little bit more eye-opening into kind of the wellness side of aesthetics as well.
Amazing. Thank you so much for having me.
Thank you, everyone. I hope you have a really good rest of the day.